every day that we wait is a day that the child is not developing correctly. And I feel that way about chiropractic, and I hope that you do too. It's changing the way they engage and process the world forever. Attention chiropractors, slayers of subluxation, unleashers of the imprisoned impulse, and protectors of the developing brain. Welcome to the Cranial Doc podcast, where we master the work that actually changes lives. Craniopathy, nervous system-based care, and the business systems that let you scale without selling your soul. I'm Dr. Anthony Pellegrino, pediatric chiropractor, certified craniopath, and proud automation geek. Let's dive in. Hey there, Subluxation Slayers. It's me, Dr. Anthony Pellegrino, with the Cranial Doc podcast, and we're going to have a conversation about two very important things today. We are going to talk about palate expanders and cults. Okay, that's a little bit silly, but when it comes to palate expanders, I feel as though we have a two cults problem in our profession, as well as definitely with our patients. We have very anti-hardware, and we have hardware is a miracle. The truth is that expanders can be awesome when the case calls for it. So in this episode today, what we're going to go through is understanding a little bit more about hardware itself, understanding what our role is in the management of airway, palate, etc. We're going to talk about what dentists look at, what we look at, when there are times that we should come together, and when there are times that we should stand apart. So hang tight. Now, the real issue that we're talking about today is that force applied to a stressed system can create new problems, right? Now, I like expanders. Sometimes I am even the one referring for them. Hardware, and when I say hardware, I'm referring to palate expanders, braces, etc., can change structure fast, but it can also expose just how stressed the system it already is. So a little bit of a kind of background, most dentists that are in your community, not all, but most, which is why it's really important that you find a good one, are looking at palate expanders through the lens of just simple crowding and tooth alignment. They're looking at it as there's not enough space for the teeth, so we need to make more space. We're going to use the palate expander, open things up, and then we're going to use braces or an Invisalign afterwards. So they're really paying attention to crowding, sometimes bite, the aesthetics, and making room for teeth. That's their lens. Our lens is going to be more focused around function, of course, and development. We are going to ask questions about tongue posture, like can the tongue actually live on the roof of the mouth? We're going to look at things like nasal breathing. Is the airway usable at rest? We're going to ask questions and look at sleep. Is there snoring? Is there restless sleep? Is there sweating? Are we having to go in odd positions to be able to stay asleep? Are we having frequent waking? Are we getting 12 hours of sleep but still acting like we skipped 7 naps? Those are all very important questions to us. We're going to look at nervous system regulation, things like our daytime behavior, our anxiety, our sensory sensitivity. We're going to look at meltdowns that look like sleep quality. And a lot of times when we explain this to parents, why we care about airway, I'll have a 6-year-old who's having this really massive behavioral issues, and maybe that parent will also have a 2-year-old. I'll talk about, hey, with your 2-year-old, what does your life look like if they miss their nap? And they're like, oh my God, it's horrible. But nobody wants to be around. It's like we look at the clock and like, oh my God, 4 more hours till bedtime? And it's like, that is where your 6-year-old has been their whole life. They're always acting that way. And that's what you're seeing. So to be short here, we are not obsessed with straight teeth. What we're obsessed with is a child that can breathe, can sleep, and can regulate. Now, because of this lens, we are typically the ones finding the palatal issues first, before the dentist. If I have a patient, and this is something that would happen years ago, before we really got deep in this work, I would have a patient that would be under care for years, and then they'd go to the dentist. The dentist is like, you need an expander. And I've never mentioned that to them. Nowadays, if that happens, it doesn't, but I would be like, what did I miss here? I messed up. I am the quarterback. I am the one that they trusted with their health. This is in my realm. It would be like, you taking care of a kid for years and they go to the doctor who says, oh, they have a scoliosis. You've been adjusting them for 6 years and you had no idea. To me, a child having palatal issues is the exact same realm. I messed something if we missed it. We're typically the ones finding this first because we're not just watching the alignment of the teeth and the crowding and watching and waiting. We are watching the function, not just the alignment. So real quick, let's talk about how the palate is supposed to grow. And we've gone through and talked a lot more about this on other episodes like our former plagiocephaly episode. So just go deeper on that if you want the specifics. But long story short, the palate grows because of inside out pressure and force. It grows along with the skull, which grows from the brain growing, which brings the CSF flow. And it grows symmetrically because there should be no tension in the dural system that attaches within the cranium as well. From our perspective, we have inside-out pressure and force, plus adaptable sutures and an adaptable suture fascial system. Think freedom in the system allows for appropriate growth of the skull. Palate and facial growth follows cranial growth patterns, and it's not totally separate from the rest of the head. So because of that, there are very clear constraint points, essentially where those facial bones are not surrounding the brain. So as the brain grows, they don't have that same inside-out force. They have something else, which we'll get to. But obviously, as that skull grows, the face and the palate are going to grow along with that. So those connection points between the facial bones and the skull bones are possible areas of constraint. So this would be places like the sphenomaxillary suture, which is where the sphenomaxillary palatine suture, depending on what reference you're looking at, which is where the palate meets the main sphenoid of the pterygoid process. We have the frontozygomatic suture, the frontomaxillary suture, by the glabella. There's all of these different pieces, right, where the skull and the facial bones meet each other. The cranial base and facial sutures, essentially, these act like a stuck hinge. If there's restriction or subluxation in the suture itself, it can change the path of growth. Now, that's for as the face goes along and grows with the skull, but there are other inside-out forces that act on the palate also, specifically the tongue. And since we're talking about palate expanders and we're talking about normal growth, the tongue is supposed to be the body's natural palate expander. Tongue up allows for wide palate input and airway-friendly development. Tongue down, the palate doesn't get grown into and function starts to compensate elsewhere. There are, of course, other components here like the food that we eat and chewing, the fact that we're not really doing appropriate at 6 months, going from a suck, swallow, breathe to a chew, swallow, breathe. There are lots of different external factors here. We're just talking about normal typical growth and development from the inside out here. Long story short, what we know is that growth isn't just genetics. Of course, genetics play a role, but it's genetics plus forces plus freedom that allow for development of the skull and of the palate. What we are looking at here is the pattern. What we care about as chiropractors is the pattern beneath the palate shape. Specifically, what restrictions or stress change how growth is expressed. We're looking at subluxation. So there are a couple different root cause categories of subluxation, as I mentioned, that we should be assessing for restriction. Again, the facial components, which is the maxilla, the zygoma, the pterygoid relationships that are affecting tongue space and anterior-fascial tone. We're going to feel for sutural restriction, because even if we're not looking at the facial sutures, if there's a restriction at the lambda or plagiocephaly, this is going to cause a torquing pattern as we go across, as we reviewed in the plagiocephaly episode. It's going to torque the sphenoid, it's going to torque the frontal, it's going to deviate the jaw, and it's going to create changes in palate growth because the whole dural system is torqued. We're not going to grow symmetrically. As I mentioned, the stress, the sutural system, and the dura often go together. Upper cervical patterns are going to affect breathing and tone and cranial base mechanics, which is huge because of cranial base, jugular foramen, choke point, venous drainage, glossopharyngeal nerve, vagus nerve, you name it, super important. And of course, tongue restriction itself is something that we want to look at, whether it's anterior fascia in an older child, we're seeing the cervical spine hasn't developed appropriately, there's anterior increased tone, the fascial restrictions affecting the floor of the tongue and the floor of the mouth, or a tongue tie, or typically both. Now, how this is going to show up clinically are things like mouth breathing that looks like a habit, right? But is actually just a survival strategy, which will graduate into things like clenching and grinding. It will also show up as things like picky eating and texture issues. It's going to show up as chronic congestion without a clear reason. It's going to show up as poor sleep, which equals poor emotional regulation. So now that we understand the way that the palate and the face is supposed to grow, the question is, when is it appropriate to use an appliance? When is it not? When is our work, quote, enough? if we can restore freedom, essentially, and correct the root cause of the restriction and have enough of a runway for growth, we might be able to see appropriate remodeling enough. Even if it doesn't get perfect again, what we care more about is the function of the system. So if we can address the underlying restriction, even if the palate is still slightly narrowed, there are many cases where we can still get appropriate sleep, still get nasal breathing, and still get nervous system balance without going and forcing the body through a structural expansion. A really key concept, though, that I want you to understand is that understanding when there is a point of no return, meaning that if I see a 10-year-old with a really stuck, narrow palate, there's not enough of a runway for growth for me to be able to ethically look at that and be like, I'm going to be able to make enough change here. We're going to need to bring somebody else in. And understanding where that point is and having clear indicators of that and ethically communicating that to parents, I feel is one of the many key components of a good, key differences of a good chiropractor and a great chiropractor. And I'm going to continue to talk about this, and that I hope pisses some of you off, right? Is because we have to understand the gravity of this. We have to understand, of course, limitations of matter. We have to understand what it is that we are doing because we're not treating a palate, right? And we have to understand when other professions have things that would be very beneficial to this child. And also when they have things that wouldn't be, so that we can, again, as I talk about here again, position ourselves as the quarterback. So we'll continue to get to that. But as we clear these subluxation patterns, what we are expecting to see clear are things like the tongue having more upward access, especially as we change sympathetic tone. Nasal breathing tolerance should increase, clenching should decrease, sleep should become deeper and more stable, and the kid just overall softens. Their nervous system tone should shift out of constant defense. I love taking this route when it's realistic, the route of being the primary and not necessarily doing other things and forcing it to expansion when it is appropriate and realistic. And I want to be the person who is pro-expander, but is saying, hey, this is a case where me, if I'm putting my parent hat on, knowing what I know as a provider, when I make that move and when I don't. Overall, our job is to respect physiology, to walk alongside growth instead of fighting it. And sometimes the body doesn't need more force, it needs less restriction. But as a provider, our goal is not to avoid appliances. Our goal is to pick and help parents find the smartest tools for their kids. With all that being said, there is a time when hardware becomes the ethical move because there is a cost of waiting. And I've used this word a couple times here, ethics, right? And I truly believe that this is massive for us. And if you're listening to this, you give a shit about being the best. And there's a lot of responsibility of being the person who maybe doesn't do more, but knows more about this than other people. And we have to understand is that we have a massive responsibility as this excellent provider, than not just accepting things, just saying this is the way that it is, this is the way that we do it. We have a responsibility because families are placing their trust in us as an expert. Not just that, because there's lots of people they place their trust in. They are going against the grain of what society says that they should do and who society says that they should trust. There is a massive step out and vulnerability that comes with the parents that trust us in our practice. And the common reaction for us is to push it off, because anything outside of chiropractic, anything outside of inside-out healing, we almost view as evil. But if the palate is too narrow, no matter what functional change that we make, if it's structurally too narrow for nasal breathing, and nasal means of breathing during sleep, nasal breathing at all, it's going to lead to constant sympathetic activation and is going to relate to constant stress and delaying an expansion in a kid who cannot breathe or sleep well, regardless of what gets thrown out of it, even if we help fix the thing, subluxation, if the structure isn't going to be able to get there, I think that that's a mistake. See, the problem is that this sleep disruption ramps sympathetic tone, and chronic sympathetic tone, as we know, impacts growth, impacts immune function, impacts behavior, impacts learning, impacts emotional regulation. And this is what the cost of waiting can look like in real life. It could be years of fragmented sleep. It could be escalating anxiety and irritability. In kids, it could be bedwetting or night terrors or bruxism or frequent waking, constant open mouth posture and low tongue posture, and getting entrenched into this sympathetic nervous system based pattern. The truth is that waiting to do this, waiting and seeing, is not neutral if we know that the airway is the bottleneck. Even if, and here's where the judgment comes, even if we know we can create enough functional structural tame to correct this, the question is by waiting, how long is that going to take? Because it's not just an adult who's just in a stress-based state. This child, their brain is laying down the pathways of how it will communicate and engage and process the world forever. So in the same way, chiropractor, that you're like, no, don't wait till 1 week after birth to get adjusted immediately after birth. The cost of waiting, of getting checked, of subluxation impacting your nervous system, every day that we wait is a day that child is not developing correctly. And I feel that way about chiropractic, and I hope that you do too. It's changing the way they engage and process the world forever. And we have to accept that this is the same thing. It's the same, but different, right? If sleep is getting wrecked during the formative years, by telling a parent to just wait, we are not in a neutral ground, right? We are actively working against their development. At the end of the day, we aren't here to win some philosophical debate about inside-out healing or appliances or anything else like that. We are here to stop a kid from cooking their nervous system every single night. Sometimes the let's wait is actually let's suffer longer. And this is where the integrity comes in. Because the all you need is adjustments forever and ever and ever, and no other health things or anything else like that ever again for the rest of your life, and you're never going to have all this issue. You're never going to miss a day of school ever. I think that hurts kids and that hurts the profession overall. What's my stance is that chiropractic and cranial work is foundational. It creates the change. Sometimes that change is dramatic, and often it is the change that is needed in the absence of doing other things. But it is not ethical to promise or structural outcomes that aren't realistic for that case, or to deny the importance of how structural outcomes would change that child's life. What excellence looks like on our side of the street is hope with honesty, expectations, and a plan to get there, and clear pivot criteria when the body needs additional support. Excellence, in this case, is knowing the difference between what's possible and what's probable, and communicating that, and empowering parents to make their own decisions. Now, how do we do that? I do it the same exact way that I empower parents to create space during pregnancy when they are getting interventions and choices and different things like that thrown at them and they don't know what to do and they're stressed and everything else like that. And I give them an acronym to work with and remember. And if you know this, awesome. And if you don't, here you go. And that acronym is BRAINS. Okay? BRAINS. B, what are the benefits of this intervention? R, what are the risks of this intervention? A, what are the alternatives of this intervention? I, which really should go last, but doesn't really work with the letters. What does my intuition tell me? What does your mom gut tell you that you should do? N, what happens if we do nothing? And S, can we have some space to make a decision? I think this is huge. And if you don't use this and empower your parents with this during pregnancy, like, especially if they're having a hospital birth and they kind of have a birth plan, like, that's just huge. It's just empower the partner. Every time anything comes up, cool. We have to do a C-section. Okay. And what are the benefits of doing that? Great. And what are the risks if we don't? And also a thing Dr. Eric Jazuski kind of hit me with one time. It's not just what are the risks. It's like, well, what are the statistics of that risk? Well, you have an increased likelihood of a hemorrhage. Okay, what's that increased likelihood? Is it a 1%? Do I go from a 1% chance to a 2% chance? Okay, cool. I think I'm willing to take those raw odds. Do I go from a 1% chance to a 99% chance of hemorrhage? Okay, cool. Then maybe this is an intervention we want to do. What are the alternatives to doing that C-section? Well, we could change position. Awesome. What does my intuition tell me as a partner? What happens if we do nothing? We'll just go another 2 hours, and if baby's not born yet, then we'll have this conversation again. Cool. And then can we have some space to make a decision, which is often the most important one. And anytime the parents have to make this choice, whether they want to, bring their kid for a surgery and they are worried about the anesthesia, which is something that I just had a conversation with the parent about this week, or whether they want to do an expander, or whether they want a natural birth, Brains is going to empower them, give them hope, and most importantly, give them context. Because hope is great, but without honesty and context, it's just simply marketing, which we're going to continue to talk about in this episode. The point is that structure matters, but also does the nervous system's ability to tolerate the change. So, if the expander is the plan, there are certainly layers that those parents must understand. Now, let's call it what it is. Expanders do create amazing structural change regardless of the restriction pattern, right? They are going to get us from point A to point B no matter what. That thing is a freaking bulldozer. It does not matter what is in the way. It's going to take us from narrow to wide every single time, right? Like it's just going to do it. It doesn't matter what's blocking. And that is why they are powerful tools, right? The problem is that the patterns that were there that caused the palate to not develop appropriately in the first place, they don't just disappear because the palate widens. And because those patterns are tied in to nervous system stress, things like sutural restriction and dural stress, by blowing through that, they don't disappear, they get worse. Cervical strain and upper cervical patterns and mechanics still influence tone and adaptation regardless of what the palate looks like. If those things aren't addressed during expansion, the expansion is going to be harder and slower and less stable than it could be. Now, if we're going to call it what it is, most people who do get palate expansion, they do that without chiropractic care and without craniopathy. So it's the difference between like common and normal, right? Harder, slower, less stable is normal. So there's nothing there that they're thinking about. We just know it's going to be slower or less stable than it could and should be. We are also going to have different compensations emerge. We're often going to see things like attempting to get the stability, clenching, headaches, flares in behaviors, and sleep disruption often get worse. Because hardware changes the structure, it doesn't change the strategy of the nervous system. If we expand shape without changing the pattern, there will be compensation elsewhere. We can remove one stressor and accidentally add a bigger one or a bigger three. So there's another reason as well, while owning this and quarterbacking this issue is really important. Because parents are often, especially if we're going to have this marketing conversation where hope without honesty and context is just marketing, a lot of these appliances are marketed as like they will just fix everything. And I laugh about this because it reminds me of Reggie Gold in the Great Chiropractic Debate, where he's talking about how if you don't actually understand the chiropractic philosophy of how chiropractors don't treat anything, they just work with the nervous system, right? You might think that chiropractors are claiming that chiropractic care can cure anything from, and I love the expression here, it can cure anything from leprosy to ingrown toenails. And the fact is that chiropractic doesn't cure anything. It just helps the body better adapt to stress. And I think of like what he kind of talks about there, that interpretation, this is exactly how that kind of like leprosy to ingrown toenails, especially as exactly how a lot of these different appliances, especially if you look at any marketing from Vivos, which is a great tool, nothing against that, but they are hardcore marketed as like a miracle cure for everything. Parents are often, because of that, they just expect these palate expanders to resolve everything. And oftentimes what you'll see is somebody who's gone through the expansion or going through it, and maybe while some things have changed, there's a lot that's like, man, we can still see the system. It's wider, but the mouth breathing is still happening, right? They haven't changed the tone. They might still even have a tie there. Like there's all of these different pieces. So in reality, we'll often see like the airway itself improve, but cranial and dural strain gets ramped up, especially due to these aggressive remodeling forces. Sympathetic tone just increases from a different direction. So we might improve the actual structure, but sleep can often actually get worse just with a new driver. The key nuance here is that airway improvement is great, but nervous system stress still needs to be addressed. If the kid's system is already stressed, adding force to that can be like just turning up the volume. So what does co-management really look like? How do we set ourselves as the quarterback? If expansion is the root, I always tell parents that we first need to reduce restriction patterns so the tissues and the cranial system can actually adapt to the changes in force. We need to get the nervous system better under control and better regulated, free from subluxation as much as possible so that we can help stabilize sleep and regulation. During the expansion, we're going to continue to get that child checked. We're going to be watching for and looking for stress spikes like clenching, headaches, neck tension, emotional volatility, and sleep regression. We need to keep cranial base and dural tension patterns clear. And be honest, we might need to increase frequency during times of seeing those spikes so that the child can tolerate the remodeling without adding extra nervous system stress. We want to coordinate the pace with the airway orthodontist. And oftentimes we'll say, hey, if you are often seeing a child and rechecking them every 8 weeks, maybe we need to do it every 4. I like to have active communication with them as well. If there is a true functional muscle tone issue as well, in addition to, especially if we have a low tongue posture, in addition to correcting subluxation and doing airway orthodontics, I will often refer to and want my patients to also see a myofunctional therapist to work on those patterns. It's one thing to create the space. It's another if we've been used to having this low tongue posture, we can correct the structure and the function, but often that child needs to be retaught what to actually do because they've never actually laid down the developmental pieces of what they should normally do with their tongue. And yes, this is going to be an intensive 2-3 months for these parents, but I will explain it is going to be it is going to be an expensive 2-3 months for you that is going to lay the foundation for the rest of your child's life. Let's go all in. And I think that most parents respond really, 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 really well to that. So, too long didn't read. Force without integration creates compensation. We are not anti-appliance. We are anti-unmanaged force. Our simple job is to help the nervous system handle the change, not just survive it, and hold our patients' hands as we walk through this. The practical point here is that a less restricted palate will move faster. Appliance checks may need to be more frequent. Pacing matters more. Oversight and having outcome measures will matter more as well. If we remove the resistance, things can move faster, which means that we need to be watching more closely, more intelligently. Now, how do we explain all of this without trashing dentistry? Well, first off, we are not competing with their dentist or orthopedist. Most of us who have been in practice for a long time can remember in the beginning of practice where a patient came in with a shoulder pain and they were like, oh my God, I need to go see a physical therapist. And we were like, well, physical therapy isn't going to fix it. The nervous system controls the muscles and blah, 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 blah. And it's like, cool, bro, you want to go to a physical therapist for your shoulder? Awesome. Glad we're getting your nervous system checked. Like, I'm in full support of people bringing in other modalities when appropriate. We are not competing. We are adding to the piece nervous system regulation, cranial and dural mechanics support, safer adaptation during that structural support. We are going to explain and frame that hardware creates the space and the care that we do will help that child use that space without compensating. The whole thing I told you about how the palate expander will move from point A to point B, how it's going to bulldoze through those restrictive patterns, but often if we just bulldoze through it, they don't just disappear, they compensate. That's literally how I explain this to parents and are like, that makes perfect sense. The dentist is widening the runway. We are helping the child learn how to land the plane. We don't want to fix one thing and trigger 3 others. So, quick recap. Expanders, great tools. Dentists often are looking at this through the main lens of crowding and teeth position, A great dentist is going to be looking at this from an airway and sleep and tongue posture position, which is the lens that we are going to be looking through it as well. Patterns underneath must be addressed during force-based remodeling. So, all of that being said, if you want more of this, no fluff, just clinical truth, I drop stuff like this first on our email list, which is thecranialdoc.com. Go in there. It's totally free. It's like emails 1 to twice a week where we go through information and mechanisms like this, applying it to your practice, as well as everything from being the CEO to using AI to automations to go high level. Whatever it is that I'm working on this week and feel called to talk about, that's what's in your inbox. It has been such a pleasure learning and studying and going through all of this. Let's get more people face down with better care for longer. Let's correct those subluxations together, fam. Have a beautiful week. Thank you for listening to another episode of the Cranial Doc podcast. I hope you got a ton of value out of today's episode. And if you did, it would mean the world to me if you jumped over to iTunes or your favorite podcast player of choice and subscribed, rated, reviewed, and shared this episode with a friend that you know could benefit. We have a ton of this information and more in our free email series at thecranialdoc.com. So go ahead and jump on there, subscribe, and get me raw, unfiltered in your inbox every week, changing your practice. Can't wait to see you for the next episode.